My name is Brady Gilson. I'm a PA. I work here at Hoxie Medical Clinic at the hospital. So I was born and raised in California. My parents moved me to Colorado, up to Greeley, so kind of northern Colorado. My dad was a surgical first assist. My mom was a nurse, so kind of just medical family background. But my first job out of school was just doing solo ER coverage in Northwest Kansas. So definitely, jumped right into it fresh as a new grad. I met my wife at that hospital. She was a respiratory therapist, and then she had goals of working in the big city, so she moved to Denver. We ended up getting pregnant, so I moved back out there, and we bought a house and raised our kid. And then about 4 years ago, Dr. Nemechek needed knee surgery, so the clinic manager then, he called me and said, hey, we're losing a doctor for 3 months. Like, do you want to come, cover the clinic and work in the ER and all that stuff? And I said, sure. And then 4 years later, here I am. They trapped me. So now I'm a full-time employee for 2.5 years. It'll be 3 years in August. And then they even suckered my wife in. So now she's the RT director here. So now we're back in Northwest Kansas. Getting involved more in the clinic side was kind of a mix of, if I'm here covering the ER and I'm taking call, instead of just sitting around, I might as well see patients and help them out. The big thing was kind of that continuity of care of, seeing someone in the ER, putting them in the hospital for a week, or I send them out for a surgery or something, and then kind of being able to follow with them afterwards as far as their supplemental care and kind of extend that continuity of care where they kind of see the same person. My style, especially if someone comes in, a hurt ankle, or strep throat or something like that, I kind of like to go in there already looking at, your wrist x-ray of your wrist that you just hurt, or, see your strep results. I feel like if I can go in there and kind of already tell you what I see or what I know, then we can kind of work on a treatment plan. And I usually try and do my best to kind of, come with like a patient-centered or patient-involved sort of treatment plan and kind of follow-up plan. And I think we've come a long way in the 4 years I've been here as far as, outreach, and with the mobile unit, they're starting to come about, and, vaccines, and trying to get with the times as far as, checking in online and kind of all those policies. But I think Hoxie Medical Clinic, I think the goal of it is kind of the one-stop shop for all your needs. If you come in, for maybe you hurt your shoulder shoveling snow, but at the same time, we're here to make sure all of you is taken care of. Make sure you have, your flu shot this year and all your vaccines are up to date, or you need your shingle shot, or, hey, you're 65 and probably need a colonoscopy, or, hey, have you seen a dentist lately, or, I know weather's been rough, are you depressed, or you want to talk to someone, or, hey, I know you're here for your shoulder, but you have diabetes. We have a food as medicine program where they give you money every month so you can buy groceries and get healthy. So I think preventative healthcare is, to me, is probably the best healthcare you can do for yourself. We can kind of, check a lot of the boxes where, big city or a different place, like you get to go to 6 different places and drive halfway around town to get all these things done. I think kind of, having all that stuff in house, and then even, the mobile clinic aspect of, if you can't make it here, we'll come to you. Working in Northwest Kansas for the last 8 years or so, I've definitely covered and worked in a lot of clinics and ERs around here. And I think that Hoxie Medical Clinic, I think, has the most caring and compassionate providers and nursing staff and front office staff. And I think this place truly cares about the people that they see and who they take care of and how they do stuff. So I think anyone would be in for a good experience if they were to come here.